on the site of the Black River Health Center, just across from the Black River Hospital. I'm here in the parish doing a tour of the health facilities with the regional director, Mr. Bent, regional chairman, Mr. Stern, and of course the local parish reps headed by Mr. Sean Brissett, and of course SM1 CEO of the Black River Hospital. I want to just report that I'm encouraged by the work that is taking place in the parish. There are 23 health centers in the parish of St. Elizabeth. 10 were badly damaged. My information from the team is that all except this one here at Black River has been reoccupied, the original building, after repairs being done to those 10 and other repairs to the others. This Black River Health Center is now under construction, and within a month we expect it to be back in operation. They are using a temporary facility with containers now on the compound, and that seems to be going well. So we do expect by the end of May, early June, for all 23 health centers to be back up. I'm told that just about 80% or a little above that of patients are back in at the primary facilities. We are going to have to work harder, the community health aides, primary healthcare team, to get citizens of the parish to come back out to their health centers. We understand the trauma that they have been through, but we don't want them to neglect their chronic illnesses, their screening opportunities, their access to drugs. So I want to use the opportunity to encourage that, and that's a challenge that I've set for the parish team here. We have to go out into communities and spend some time to just encourage the mothers, the children, the daughters and the grandparents to come back to their health centers. Now in terms of the hospital, we're making good progress here. As you know, Samaritan's Purse was here and they had a temporary facility, and they have given us that and we have been using it to date. Happy to report that both the male and female wards should be up by the end of June, so another 2 months or so. Construction is well in progress. They're about to put the metal roofing and then the slab, which will also protect it from future hurricanes. So it's a much stronger facility, infrastructure. And then of course the operating theater is to be commissioned within 2 weeks. That's a big achievement. The 2 operating theaters are now installing lights and other finishes, which means that we can now do surgeries right here at Black River in the original building, but new and improved. And that's very positive. The next phase will be to look at the maternity ward. So there'll have to be a provision for the maternity ward in the original building until we rebuild that, and the administrative structure. The team, of course, did the staff quarters, and the staff quarters are now ready. They may need to use some of the staff quarters for outpatient services, the rest of staff to occupy. So generally, I think Black River Hospital is well advanced over the next 6 to 8 weeks to be fully commissioned, at least for ward space, close to 150 beds, which will take pressure off Mandeville and certainly Sablamar in some cases, and Spaldings and so on. So I'm happy to report that the health team is working, the region is working, and the parish of Black River is making good progress as part of Melissa reconstruction. Final point is that we are doing an ecological study to look at the location of our health facilities. And so there may be additional major renovation, rebuild for the final resilient phase. Right now, the challenge is just to get everybody back up and going and to ensure that we can provide health services. And so far, so good. I think the team has done well. So I want to thank the team at Black River Hospital, team in the parish, team at the region, and we will continue to monitor the situation and work to support the people of St. Elizabeth.